So, good morning. I am Kate Gabriel Vergara from Mother of Perpetual Hope. So, today I will do the physical assessment for the posterior thorax, anterior thorax, and the abdomen. So, we will now start. So, hello guys. Today we will do the physical assessment in the posterior thorax. So first, before doing the assessment in posterior thorax, we first have to introduce ourselves to the patient, verify the client's identity, and explain to her what are we going to do, why are we going to do this, and what are the things he or she should do during the assessment. So, good morning, sir. I am Kate Gabriel Vergara, your student nurse for today. May I know your name, sir?
Christian Moreno.
So, Sir Christian, when is your birthday?
April 14.
So, Sir Christian, I will do assessment in your posterior thorax. Is it okay with you, sir?
Yes.
Okay. So, first, we will have to ask the patient for his history. If there are any history of his family of any illness or diseases such as cancers or tuberculosis, bad habits such as smoking and drinking alcoholic too much. So, sir, have you been engaged into bad habits such as smoking or drinking alcoholic drinks?
No.
Okay. So, sir, have you been diagnosed for any illness, diseases, or cancer? Okay. So, after that, we will now have to wash our hands. Make sure that we will cover all the areas. So, after that, we will provide the privacy of the client. We will close the doors, the windows. It's for them to feel comfortable as well as to make sure that we will provide them the privacy that they needed. After that, we will have to instruct the client to turn their back on us. So, sir, can you turn back? So, after that, if the client is wearing a gown, hospital gown, we will untie the gown and then expose his back in order to clearly inspect the posterior thorax. So, in my patient, he is wearing a t-shirt, so we will instruct him to get it. So now we will have to inspect the scapulae and the chest wall of the patient. So in inspecting it, we will have to inspect the shape and the symmetry. We will inspect it in a lateral view in the side and then in the posterior view. So in behind. So as you can see, it is symmetry, which means both sides of the chest wall, scapula is equal. So, it's good. Now, we will have to note the use of accessory muscle when the patient is breathing. Sir, can you breathe for me? Inhale, exhale, inhale, exhale, inhale, exhale. So, it is normal. So, there are no problems when he is breathing and he is not using any accessory muscle. So, normally, those people who uses accessory muscles when breathing is those who have suffering from respiratory distress such as asthma, suffering from asthma. So, now we will have to palpate the posterior thorax. So, we will assess for the temperature and the skin integrity of the chest wall. So first, we will have to do it here. And then, sir, do you feel any pain?
No.
So, if the client has any respiratory problems, there might be a tenderness or muscles in the chest wall. So, as we have seen, as I have felt, there is no problem, there is no tenderness in the chest wall. So, now we will have to evaluate the chest expansion in the T9 and T10. So, in doing that, we will put our hands into the T9 and T10 part. And then, we will instruct the client to breathe. Sir, can you breathe for me? Inhale, exhale, inhale, exhale, inhale, exhale. So, after doing that, we have seen that our thumb was moving 3 to 5 centimeter, which is normal. Now, we will have to percuss the posterior thorax. So, we will have to percuss in order to feel if there are any air or liquid or solid materials in the underlying tissue. Also, to see if the certain organs in its position and boundaries. So, in percussing the posterior thorax, we will use our non-dominant hand, the middle finger, and we will use the dominant hand in doing it. So, first we will have to start here and then do this. So, this one, we will do this. This one. Percussing the back of the client, we have seen that the percussion is resonant except for the part of the scapula because there are bones in there. So, it is normal. We will auscultate the posterior thorax. So, in auscultating, we will use the stethoscope. So, we will use the diaphragm of the stethoscope. So, we will check. So, sir, can you do a deep breath? Inhale. Okay. Exhale. Inhale. 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 Exhale. Okay. Inhale. Exhale. Inhale. Exhale. So, after auscultating the patient, we have heard that there are no adventitious sounds, breath sounds such as wheeze, rub, friction, or any problems. So, it's normal. Now, after auscultating, we will have to test the skin mobility and turgor. So, in doing that, we will pinch the back of the patient and see how fast it comes back to its normal shape. So, it was, after 2 seconds, it came back to its normal shape. So, it's normal. It's normal. So after that, we will ask the patient to sit properly and pull their hospital gown into their waist. And then let their hand hang freely. So after doing that, we will have to document the findings in our assessment. And then we will now proceed to the next assessment.